A logo, U.S. Department of Health and Human Services. A welcome page highlights a module title.
Thank you for joining our session, Key Roles in Maintaining and Optimizing the Certified Complete Electronic Health Record, or EHR. This is part of a series of educational modules to provide additional information and guidance around health information technology, or health IT. The other session titles are What is Health Information Technology and the National Initiative Meaningful Use? And Key Roles in Implementing a Certified Complete Electronic Health Record.
Target audience.
This module has been developed as an orientation to the Certified Complete EHR optimization for staff working in safety net healthcare settings, such as community health centers, federally qualified health centers, and freestanding clinics. These modules are designed for use in a variety of settings. In an organization that is already live on a Certified Complete EHR, these modules can enhance the new employee orientation process. Alternately, this session could serve as an orientation module for a team that is embarking on their EHR implementation. Finally, health centers focusing on the Centers for Medicare and Medicaid Services Meaningful Use Initiative program would also benefit from this module.
Pre-module questions.
These questions were created to test your knowledge of the concepts before they are presented. The screen will flash first with questions and will give you a couple of moments to jot your answers down. You will be able to check if your answers are correct. Thank you for taking the time to answer these pre-module questions. Question 1. Optimization of a certified complete EHR means putting this technology to work in a way that will enhance its efficiency, effectiveness, and end-user satisfaction. True or false? Question 2. Why is optimization important for technologies such as a certified complete EHR? Question 3. It is important to have a sponsor throughout the optimization process, even though the initial implementation work has been completed. True or false? Question 4. If a health center creates an optimization team, the following are important individuals to have on the team. A. The sponsor. B. The quality improvement representative. C. The EHR manager. Or D. All of the above. Question 5. Health centers should be reviewing system use data, performance data, and user and patient satisfaction during the optimization period. True or false? Question 6. I'm familiar with the process of performance measure validation. Yes or no? Question 7. What does the term usability mean? Question 8. Usability also includes counting how many clicks it takes to get from one point to another. True or false? Question 9. The current big quality trend includes a shift from measuring improvements in outcomes to measuring processes. True or false? Question 10. There are 3 stages of meaningful use. True or false? Now let's take a look at the answers. Optimization of a certified complete EHR means putting this technology to work in a way that will enhance its efficiency, effectiveness, and end-user satisfaction. And that answer is A, true. Question 2. Why is optimization important for technologies such as a certified complete EHR? This question is open-ended, but you definitely want to make sure that you and your team work to continually optimize technologies such as your certified complete EHR. Question 3. It is important to have a sponsor throughout the optimization process, even though the initial implementation work has been completed. This answer is A, true. Question 4. If a health center creates an optimization team, the following are important individuals to have on the team, and that answer is D, all of the above. Question 5. Health centers should be reviewing system use data, performance data, and user and patient satisfaction during the optimization period, and that answer is A, true. Question 6. I am familiar with the process of performance measure validation. That answer is either yes or no, but performance measure validation is a systematic approach to identify reasons why measure results are not as accurate as possible. Question 7. What does the term usability mean? This is also an open-ended question, but usability is the effectiveness, efficiency, and satisfaction with which the intended user can achieve their tasks in the intended context of a certified complete EHR use. This is a good topic of discussion for your team. How usable is your certified complete EHR? How much control do you have over making changes? Question 8. Usability also includes counting how many clicks it takes to get from one point to another, and that answer is false. Usability principles focus on how meaningful each mouse click is. Question 9. The current big quality trend includes a shift from measuring improvements in outcomes to measuring processes, and that answer is B, false. It's actually the reverse. We're focused on moving from measuring processes to measuring health outcomes. And question 10. There are 3 stages of meaningful use, and that answer is A, true.
Objectives.
Implementing a certified complete electronic health record at your community health center is an important step for your organization. However, the health center must commit to maintaining and optimizing its use for patient care, quality, and user satisfaction. It is important that you, as an implementation team member, have a good understanding of the following: what optimization means, key team members and their role in the certified complete EHR maintenance and optimization, and knowing the role that initiatives like meaningful use and quality play in optimizing your system. Optimization for your certified complete electronic health record means putting this technology to work in a way that will enhance its efficiency, effectiveness, and end user satisfaction. There are different ways that you can optimize your system: using a data warehouse or reporting software to pull the data you need, enabling other functionalities like e-prescribing, or working with your network, your vendor, or your informatics team to change the templates used so that you can efficiently capture comprehensive and accurate clinical data. These are all examples of great ways to enhance or optimize your system. There are many resources available to your team as you continue to improve your certified complete EHR use and user satisfaction. These might include your regional extension center, primary care association, health center controlled network, and your software vendor.
Key optimization team roles.
Similar to the certified complete EHR implementation process, it takes a team of committed parties to ensure that your optimization stays on track and that the needs of the user, the patient, and the organization are met. In this module, we will discuss key roles involved in maintaining and optimizing your certified complete EHR. Based on your staffing model, available resources, and the health IT skills inherent on your team, your model will likely look somewhat different. Keep in mind that there are resources available to you through your regional extension center or health center controlled network if you need assistance and support. Let's meet some of the key players that are important to your optimization work. Keep in mind that this module provides one example of how staffing could occur. With us today is Mary, your health center CEO. She has been serving as the sponsor of the project. As sponsor, she's been checking in with the implementation team to understand the tasks at a high level, the deadlines, and how to help push things ahead. She supports the team and helps secure resources necessary for the optimization tasks. We also have Valerie, your health center's EHR project manager. She's been working closely with your team at your health center controlled network to get your organization live on the certified complete electronic health record. She may continue working hand in hand with the network and the software vendor as she looks at additional functionalities, reporting, and training needs of your organization. Tiffany is your quality improvement manager. Her team is responsible for reviewing and validating certified complete electronic health record data. As initiatives like meaningful use and patient-centered medical home come into play at the organization, she ensures that the clinical templates for the certified complete EHR can capture the discrete data correctly. Dr. Harper is your provider champion. She's been one of your great provider champions during the EHR implementation. She will continue to bring the voice of the clinical users to the table when making decisions that impact them directly.
CEO, ensuring adequate resources.
Hello everyone, I am Mary and I'm the CEO at the Health Center. Our implementation team has worked very hard over the last several months to take us live on a certified complete EHR. It was a very exciting and very successful project. In my role as CEO, I provided leadership and support to our implementation team throughout the project. I also made sure the project had the resources it required for a successful go-live. I attended meetings when I could, and I also received regular updates from our EHR manager and provider champion. Now that we are live on the EHR, our work really begins. First, I need to recognize and appreciate the valuable resources needed to maintain an optimal certified complete EHR. I need to ensure the rest of my leadership team, such as our Chief Operating Officer, Medical Director, and Financial Officer, continue to provide excellent sponsorship of the EHR. They know it needs to be well maintained in order for us to use it effectively. This team continues to support these processes financially, operationally, and clinically, and they help to promote ongoing trainings and provide workforce development. I touch base regularly with our quality improvement staff to ensure that the EHR can provide all the data required to make operational decisions at the health center, as well as analyzing eligible professional reports for meaningful use. I also ensure the EHR manager has everything she needs to perform her duties. She reviews the meaningful use eligible professional reports that the QI team runs, and then she develops ongoing training in areas where we need improvement. She gathers users' feedback around workflows and reporting needs and makes changes to better support our staff and their optimization of the EHR. It's important that we, as a leadership team, prioritize the availability of human and technical resources in order to manage and complete the work. In fact, we created an optimization team that is composed of providers and nursing representation, quality improvement, billing, and operation. Our EHR manager heads up that team to keep us on track. In your health center or safety net setting, the team composition might be different. The bottom line is that a dedicated group that can represent our core staff functions comes together routinely to discuss what works and what needs attention. About 6 weeks after implementation, we conducted a post-go-live assessment. This assessment took place over the course of a few days. The agenda included sessions shadowing providers and the nursing team to evaluate standard workflows and to take advantage of the basic functions of the electronic health record. There were also sessions for the management team that provided information about meaningful use and future add-on features like the patient portal. By reviewing our current state, we were able to identify solutions to head off some potential problems, like making sure our encounters were labeled as office visits, so appropriate provider encounters would count for meaningful use. After the assessment, a report of our strengths and opportunities for improvement was generated. Our EHR optimization team developed an action plan as a result of that report, and we frequently monitor our progress. Let me tell you more about what happened during the post-go-live assessment process. We learned how to use data from the Certified Complete system to help us make operational decisions. We reviewed system use data, which shows us how often certain features of the EHR are used. We also reviewed performance data, which gives us snapshots of how we as an organization are doing both clinically and financially. We are initiating a satisfaction survey process to collect baseline data on how satisfied our users, as well as our patients, are with the new technology and what we could be doing to improve it. I'd like to share more about what our health center is doing specific to system use data and performance data. So what is so important about system use measures? We know that the clinical staff are using the EHR for clinical documentation. System use measures are measures that quantify whether and how often certain aspects of the certified complete EHR content is being used. For example, we run a report on how many providers are actually using and printing our clinical visit summary forms, which is important for meaningful use. The first month's data showed that only 31% of providers were actually filling out this form. After a brief training with clinicians during a provider meeting, that usage spiked to 60% in just 2 months. We want to continue to improve upon this measure and hope to make these trainings a routine part of our staff meetings. The second area, performance measure validation, was another big topic of discussion during our post-go-live assessment. By definition, performance measure validation is a systematic approach to identifying reasons why measures results are not as accurate as possible. The methodology is as follows. The health center takes a sample of patients not meeting the measures. The next step is to manually review a sample of chart data in the Certified Complete EHR to identify 3 items. Why someone did not meet the measure. For example, perhaps there was a valid exclusion. We then look for evidence that the measure was indeed met but not captured. And the third step is to verify that the patient really did fail the measure. Once that confirmation is complete, we put our findings into action to ensure that the right data for the right patients are put into discrete fields so we can pull the information out of the EHR appropriately. Let's look at a specific example. We happen to have an action plan for height and weight, as it is a meaningful use measure. We look for patients with the appropriate criteria that should be in the denominator. In this example, the denominator would be all patients with a face-to-face encounter with a provider. Then we find out why their height was not taken. For example, did they leave the health center without being seen? Did they refuse to provide a height and weight? Once we see that this patient should be included in the numerator and is not, we retrain health center staff to document that information appropriately. Our post-live assessment was extremely successful in highlighting what the teams were doing well and where we should consider making some changes. As I mentioned, we created an action plan from the findings and created 4 buckets for our action items. The first bucket is EHR tables setup. What changes do we need to make in the tables to better support use of the application, such as making sure all provider information is there to use e-prescribing, and then adding new pharmacies to the library? Clinical decision support. Reviewing what discrete fields are available on our forms that providers use, and creating clinical decision support prompts to assist providers in managing patient care. The third bucket is workflows. Here we review adherence to workflows such as who is checking allergies, problem, and medication lists. That's not only for meaningful use compliance, but for patient safety and quality care. And our fourth bucket is training, where we review our approach to new employee and ongoing training. We're reviewing measures important for meaningful use as well as our grant reporting and determining if shadowing or desktop training is a better approach. We are also writing up a comprehensive training outline so we don't miss anything. By sticking to our plan of reviewing and maintaining the EHR setup, clinical forms, workflows, and trainings, we're getting great feedback from the majority of our staff. Our providers are happy to see that the changes they request are implemented as soon as possible. Our nursing team and behavioral health teams are appreciative of the extra trainings to reinforce what to document and where, and our billing and leadership teams are happy to get our financial performance numbers with a few clicks of a button. Our organization's intent has always been to create a data-driven culture, one that acknowledges the importance of discussing change and its impact, asks, do we have the necessary information and data to make a decision, knows that decisions should be made through the use of facts and not emotion or presumptions, and places importance on making specific, measurable, achievable, realistic, and time-bound objectives, otherwise known as SMART goals. It's been a very rewarding process, and I look forward to see what the next year holds for us.
Setup changes.
Hello, I'm Valerie, and I am the EHR manager at our organization. As lead of the optimization team, I make sure that we stay on track with our action plan from the post-go-live assessment, as well as keeping my eye open to the new opportunities for improvement. Some of my optimization work includes keeping up to date with the problems, medications, and allergy lists that our providers put together. I make sure that we don't have outdated items on these lists so our billing charges come over cleanly. I also create order sets in our system, which comprises of tests, in-house procedures, and referrals, so clinicians can select them quickly. This also helps to facilitate the ease of the use of the computerized physician order entry, or CPOE, which is one of the meaningful use measures. I review patient education materials, including the clinical visit summary, to not only ensure we have what we need for meaningful use, but to make sure our patients can understand and learn from them. Our medical records department scans outside documents that come in, such as consultation reports and x-ray results, into the system. Our providers then sign the electronic copy. I help them create document types on the back end so we can capture the result information in a discrete field. Data from the discrete fields can be pulled for reporting purposes. I also manage our bidirectional lab interface. Tests push over to our lab vendor then forwards the results back and they come right into the chart. These are just some of the features that I help manage. Another important aspect of the Certified Complete EHR management is working with providers and the quality improvement team to make sure we have all the necessary clinical template fields that we need. When we focus on an initiative like meaningful use or an important grant, we look to see if we have a discrete field in one of those forms that we currently use. We may need to create a new template that will be the provider's encounter. For example, if we don't have the clinical visit summary form in our adults visit, we need to ensure we put that form into the template so providers are prompted to fill it out and print it. A clinical template change that could be made would be to move that information into a prime area where users will see it right away. That's what we had to do for our smoking status and cessation questions. We noticed that the rates of the smoking assessment and advising patients to quit were low. We were able to have the smoking and cessation fields move right to the front of the vital signs page to ensure our nursing team would address it and it wouldn't get lost within the visit. With the help of our network, we consistently look at the content and the forms for usability purposes. Usability is effectiveness, efficiency, and satisfaction with which the intended users can achieve their task in the intended context of the Certified Complete EHR use. We make sure we always have some assessment of the provider's usability, whether that be by observing the clinician or a test of where to document certain information. This is important and is an ongoing task for the optimization team. So, what is usability supposed to feel like? Users should be able to make the following statements when usability is applied to the application. Everything I need is right in front of me. My eyes are not jumping around. I don't have to think about it. I don't have to ask, what does this mean? I don't have to figure out where to go. It just makes sense. Despite what many may think, how many clicks is not a true indicator of usability. What if an extra click here meant that the next provider seeing that patient could see what was charted last time right in the form? That the quality improvement team did not have to manually extract data for your UDS report? Or that a provider met compliance for meaningful use and received funding for your health center. In these cases, and many others, we need to choose quality over quantity when talking about usability. As previously mentioned, we're always reviewing the forms and looking for good real estate to place clinical decision support prompts to assist our providers. The disease management forms we use are a good example of areas where we can include such prompts. The recommendations in red can prompt the provider to order a certain test or procedure depending on the situation. We want to make sure our patients are coming in to get the care that they need. That's why monthly dashboards were created to monitor our progress in our patients' health. One of the measures we review is making sure a patient with chronic conditions, like those with HIV, come in every 3 to 6 months. The data is shared with all of the care team, including medical assistants, nurses, and clinicians, as all of their work directly impacts the measure. By reviewing these percentages closely, we're able to work with our HIV outreach team to help bring in those patients that have not seen a provider in 6 months and need to be seen. It's great to be able to work with the quality improvement staff so closely. We feel like we're really making a big difference in patients' lives.
Quality Improvement Director, Future of Quality.
Hi, I'm Tiffany, and I'm the Quality Improvement Director at the Health Center. It's great to hear my colleague Valerie say all the good things about my department, and of course, they are all true. We really are knee-deep in measuring all the processes and operational pieces needed by our health center. There has been a big shift in quality, however, and that is the movement from measuring process to measuring outcomes.
3 quality improvement strategies.
The first step in our EHR journey was to look at the documentation by clinicians. It is the necessary information going into those discrete fields to get captured in our reports. We then focused on processes. Are we doing the right things, like reviewing and acting on protocols for the targeted patients? Now we've moved to monitoring patient outcomes. Are the patients actually getting better? The 3 stages of meaningful use follow that same strategy. Step 1 is getting the information in the right place in a coded format. Stage 2 of meaningful use focuses on functionalities like clinical decision support to help perform the right action or intervention that a particular patient needs. And stage 3 of meaningful use focus on if we are actually improving the health outcomes of patients. Our rule of thumb is what gets measured gets managed. There are so many data and reporting demands on us as a community health center. At times, it feels challenging to keep up. But if we can focus our efforts, choose measures that are meaningful, and put actions into place to improve those measures, we'll see good results. Our EHR project manager previously talked about moving the smoking and cessation questions to the front of the encounter toward the vital signs. Our nursing teams have been diligently asking the patients these questions. Since then, we've noticed a positive increase in our numbers. Patients are being asked if they smoke. If they respond yes, our nursing teams are providing education about steps to quit. While our numbers look better, a major problem still remains. People are still smoking. We need to focus our efforts on getting people to not smoke at all, and boy, do we have our work cut out for us. It truly takes a team of dedicated administrative, clinical, and support staff to get patients on the right path of healthy living.
Provider Champion.
Hi, I'm Dr. Rita Harper, and I'm a physician on the EHR implementation team. I'm one of several EHR provider champions at our health center. I was on weekly implementation planning meetings for the electronic health record. A lot of time and effort went into that initiative, but I knew our work was only beginning. We're interested in continuing to shape the certified complete EHR and make it truly our own. That's why I wanted to be on the optimization team. One of the 4 major buckets we have in our action plan is workflows. We had a fairly good list of what each user was supposed to ask and cover throughout an office visit, but those really needed to be tightened up. After we validated certain measures, we took note of which patients did not meet the measure and reviewed who signed or contributed to that document. We then went to that individual to remind them to put the clinical information into a discrete field. For example, during the go-live period we started, it was important to check allergies, but we didn't specify if it should be the provider or the nursing staff. In some cases, providers were doing double work and asking about allergies when the nurses asked the patients already. In other cases, the providers assumed, without asking, that allergies were already checked and verified. Sometimes the nurses were free texting or writing the allergies in a free text field. That data was not getting captured. For meaningful use, we need to make sure that we maintain an active medication allergy list. During a provider and nursing team meeting, we determined that the nursing team would be the ones to always verify allergies. We talked to the staff about this verification being at the beginning of the visit to ensure it was addressed, and we showed them exactly where to document and check off that allergies were reviewed. We ensured that our QI vision incorporated meaningful use measures and language, as that has become a major focus in our health center. The EHR is a great tool for enhancing our ongoing quality improvement efforts in monitoring meaningful use measures. After monitoring the data, we saw a positive jump in our numbers, and we're on our way to achieving meaningful use. The optimization team decided to make training an ongoing priority. Knowing that training does not end after go live, we decided to include meaningful use and certified complete EHR topics to all internal meetings, whether it is for clinicians or administrative teams. Our ongoing trainings are formal and consistent. They cover new additions and functionalities as well. Users are in the group training with appropriate questions and answer sessions and peer interaction. In addition to our EHR manager, super users help lead the trainings. Because we work in those respective departments every day, they can answer those clinical and administrative questions. Finally, show them the data. During meetings with users, display their quality measures and reports that are run in real time, focused on their documentation. Are we asking the right things to the right patients? Are eligible professionals meeting the meaningful use measures? And most importantly, are we seeing an improvement in health?
Provider Champion Training Plan.
Our organization went live on one version of the Certified Complete EHR software. From now on, we will have series of upgrades. Sometimes the upgrades are so large, they may look like mini implementations.
A table.
Here's one part of our training plan from when we were undergoing an upgrade. We knew it was a good opportunity for all staff to receive some retraining on certain key points. We had to decide between demonstration training, where our EHR manager stood in front of the department and reviewed important takeaways, or classroom training, which comprised of small groups of participants sitting at a workstation and learning the material. Ongoing training is a key element continuing to get clinicians buy-in, but it's not the only important thing to keep providers excited about using the Certified Complete EHR. Start with low-hanging fruit. Adding medication or problems to their custom lists, or creating a letter or handout that providers want for his or her patients will keep them engaged. Manage the expectations of clinicians. Help them understand what the Certified Complete EHR can and cannot do. Find commonality in what providers want. Make sure the change requested will work for the majority of providers in the department. Show them the provider level data and talk to them about questions and concerns they have to move the data in the desired direction. And finally, keep a good, positive attitude. We sometimes don't choose what happens to us, but we can choose our attitude about it.
Thank you for joining us today. Make sure to check out our other modules on what is health information technology and meaningful use, as well as key roles in the implementation of a certified complete electronic health record.
References: ipro.org and ergonomic requirements for office work with visual display terminals, guidance on usability. Brought to you by the Health Resources and Services Administration.